Hello everyone. I welcome you all to the new episode of Meet the Knee Expert. Like every month, we have Dr. Parag Sancheti with us to discuss with us on different topics about bone and joint health. Thank you so much, Dr. Parag, for joining us today.
Thank you.
So, of course, we're going to discuss about some topic related to orthopedic health. But before that, I want to discuss with Dr. Parag about his recent visit to US and Canada. So,
Sure.
sir, can you tell us a bit more about your visit?
Yes, just 3 weeks before I was in Canada and USA. In Canada, I visited the McMaster University Hospital, which is in Hamilton, about an hour's drive from Toronto. And I met with the Dean of the Health Science Faculty, Professor Paul O'Brien. It was an excellent meeting. This all was possible because the chair of the surgery department, Dr. Mohit Bhandari, he was my host and he made sure that I saw the entire Hamilton hospital of the McMaster University, met with the dean, and it was a great experience to be there. Additionally, I also went to Mass General Hospital in Boston, and the Harvard Medical School is the one which is affiliated to the Massachusetts General Hospital. There I was hosted by Dr. Mudgal. It was again a very, very good visit. And the last visit was to the world famous Mayo Clinic, the Mayo Clinic at Rochester, Minnesota. Here I was hosted by Professor Dan Berry, and this visit was an excellent visit, an eye-opener, I must say. So all in all, it was a great trip to Canada and US, mainly to see hospitals and how they function.
So I would like to sort of dive deep a bit more into your recent visit. So you've always made sure that Sancheti Hospital brings in world-class advances in the medical field so that it's available for the people of India. What were the key highlights, would you say, from your recent visits to all these clinics, and what newer advances that you experienced there?
So each hospital had its nuances. For example, I was in Mass General Hospital, which is a 200-year-old facility, and they've had various buildings coming up one after the other. I also saw Mayo Clinic, which was again 150 years old, and the Hamilton Hospital, McMaster Hospital. All these hospitals had nuances, but I would say the common thread across all these three hospitals was patient care, patient centricity. One of the things which drove me in Mayo Clinic is one of the sayings which was written there: the interest of the patient is the only interest to be considered. What a profound statement. So the main thing was patient care, patient centricity. Everything, whatever was done at this hospital, was keeping in mind the interest of the patient and what will be really good for the patient.
And I'm pretty sure that would have resonated with you because, as we all know, Sancheti Hospital's ज्याला आपण ब्रीद वाक्य म्हणतो is रुग्ण सेवा हीच ईश्वर सेवा, and that you follow at Sancheti Hospital always. So now Sancheti Hospital is coming up with a expanded newer hospital, and I'm pretty sure there are some newer advanced techniques that will be used there. So what during this visit that you saw that will be implemented at the new hospital? And also, can you tell our viewers a bit more about the new hospital?
Yes, sure. So first of all, as you said, Rugna Seva, his Ishwar Seva, service to patients is like service to God, is definitely what we follow, and that is the whole essence of the practice at Sancheti Hospital. This visit was definitely an eye-opener to actually re-emphasize this philosophy of ours, and the extent to which these three hospitals took it was another level. Very, very professional in their approach, very, very driven to the cause of betterment of the patient and treatment of the patient. And as you said, we are starting the new advanced OrthoCare hospital very soon, which is a 150-bedded facility spread across 12 floors, 3 underground floors for parking. And what I saw here in terms of technology is something which we want to bring across. Again, today is the world of AI and everything related to machine learning, and this is what I found especially at Mayo Clinic. They have a special department, and I met with one Dr. Cody, who is in charge of the artificial intelligence department. And he was telling me how the algorithms are now being formulated with the help of artificial intelligence. And I think this is the new thing also in the healthcare. Your decisions about how to treat the patient can be supported by AI because it's very fast. And if you have the right data, then they will give you the information processed so as to have a good treatment modality. So that is one thing which I saw. And then of course they have various machines now. They have the 7 Tesla MRI machine. They have the latest 3D imaging where they actually make the bone models and then see the model in 3D, how it would be, how a fracture would be fixed, or how is the deformity. In addition to, of course, various softwares which were used for better patient planning. And all in all, it was a very good experience and we've got back a lot of technology. You know, one thing I feel is that putting this technology into practice in Sancheti Hospital is not difficult. Of course, it comes at a cost. It comes at a financial cost. But other than that, we have to be ready to have that technology into our practice in terms of getting the people involved. You know, the training would be there, the technicians to run those machines. So we are working on that, and very soon when we start our new 150-bedded advanced OrthoCare hospital, we will have all of this.
So data-driven approaches and new practices, newer technologies, of course, are all aimed at one thing, that is improving patient care. Can you tell us a bit more about how all of these new practices and technologies will, at the end, improve patient care, improve surgical outputs, and about that, how this will help patients of Sancheti Hospital?
Absolutely. So whenever, you know, I'm getting in a new technology, a new technique, a new machine, or whatever it may be, the first question I ask is, how is it going to improve the outcome of my patient? And if the answer to that is positive, if there is going to be a difference, then definitely we are going to adapt and adopt to that technology. The main thing what we are doing at the Advanced OrthoCare Hospital is SGH, Smart, Green and High Tech. So what do we mean by smart? This is exactly where the artificial intelligence comes in. We are going to have, you know, all the data of the patient with a single ID number. We are going to link the Aadhaar card to it. And whenever a patient comes in, we will have the entire data of that patient if he has been to us before, or then we'll start tracking it from there. Based on the back data, we can find out if the patient is going to be more prone to certain orthopedic problems, to osteoarthritis, to back pains and neck pains, and this is going to be possible. And if we can predict that ahead of time, we can change the course. So that is the smart bit. We are also going to have a green hospital. When we say a green hospital, this is going to be the Indian Green Board certified hospital. It will be the first hospital in Pune to be certified by this board. And the advantage, or why we took this certification, is that the materials which have been used in this hospital are very, very patient friendly, environment friendly, and they will definitely help to enhance the whole environment in which the patient is going to get better. And lastly, high tech. So when we say high tech, it's all about technology in terms of the equipment we use in the hospital. Any hospital, surgical hospital like our orthopedic hospital, the heart of that is the OT, the operation theatre. And now orthopedic surgery is driven by gadgets and newer machines. Like we have now a OAM machine in our hospital, which is an intraoperative CT scan. Who thought a decade ago that we would be able to do a CT scan while doing a surgery? So that's a reality. We have robotic surgery to give us precision. We're going to have monitoring of the patients while the surgeries where there may be neurodeficit. After the surgery, during the surgery, we will monitor and we will know with this neuro monitoring what is happening. So technology is going to be enhanced and adapted in the OT, and this is what it makes the patient, makes the hospital high tech. So SGH, Smart, Green and High Tech, is what we aim for in Sancheti Advanced OrthoCare Hospital, which hopefully will start in the next few months.
That's just amazing. Thank you so much, sir, for sharing all of that with us. And I'm pretty sure this new advanced care hospital will make sure that even better patient care is provided at Sancheti Hospital. Thank you so much for sharing that with us.
Thank you, Dr. Saurabh. It was a pleasure again to be with you in this edition of Meet the Knee Expert. Even though we didn't speak much about knee, but it's good to tell our listeners what are the new things we are doing at Sancheti. And right now, that's the only thing on my mind: how to really make this advanced OrthoCare hospital more friendly for our patients, more useful in terms of getting better outcomes for our patients. And thank you so much for inviting me to this program, Meet the Knee Expert, and asking me about my recent visit to USA and Canada. Thank you very much.
Thank you so much.